Evening. Deputy Speaker, I do rise this afternoon to speak on the Social Services Legislation Amendment No Jab, No Pay Bill of 2015. It is a bill which delivers on our undertaking in the budget to enact measures to ensure our nation's children receive the necessary immunisation against disease. From the 1st of January in 2016, this bill will ensure children fully meet immunisation requirements before their families can access childcare benefits, childcare rebates or the Family Tax Benefit Part A supplement. This government believes in rights, but it also believes in responsibilities. This government makes no apologies for enacting a policy that will deliver better outcomes for our children, especially when it comes to ensuring their health. Australian childhood vaccination rates are over 90% across the ages of 1, 2 and 5. Of course, Mr Deputy Speaker, this is an excellent rate of vaccination and is part of the reason the health of our children is so good compared to countries across the world. While vaccination rates in Australia have increased since the Childhood Immunisation Register was established back in 1996, vaccine objection rates for children under the age of 7 have also steadily increased. There has been a marked increase with the rise of social media and the impact of unfounded claims around vaccination of children. It is estimated that there are 39,000 children under the age of 7 and under, or 1.7%, who are not vaccinated because their parents are vaccine objectors. It is simply not right that these children are put at risk due to misinformation in this space. This government is very concerned at the rate of vaccine objection and the risk it poses to the broader community. In the budget earlier this year, we made the commitment to take steps to rectify this situation, and we are delivering on that commitment today in this bill. The Coalition Government is strengthening immunisation requirements for children. From the 1st of January 2016, conscientious objection will be removed as an exemption category for childcare payments, childcare benefit and childcare rebate, and the FTB Part A end-of-year supplement. Immunisation requirements for payment of the FTB Part A end-of-year supplement will be extended to include children over 12 months old. From next year, no vaccination objections will be accepted in order to receive the FTB Part A end-of-year supplement and childcare subsidies. Exceptions to the policy will apply only for valid medical reasons. I repeat, exceptions to the policy will apply, but only for valid medical reasons, such as when a general practitioner has certified that vaccinating the child would be medically contradicted, or that vaccination is unnecessary because the child has natural immunity from having contracted the disease in question. Families with children participating in an approved vaccine study will be taken to meet the immunisation requirements for the duration of the study, and similar rules will apply where a vaccine is temporarily unavailable. The requirements will also be met if a recognised immunisation provider certifies that the child has an equivalent level of immunisation through an overseas vaccination program. Deputy Speaker, the Coalition Government takes the health of our children seriously. 39,000 Australian children under the age of 7 are at this very moment not vaccinated because their parents are vaccine objectors. That is twice the population of the city of Burnie in my electorate of Braddon. Twice the population, Mr Speaker, are at this moment at risk of contracting a serious disease. This government does not accept this state of affairs and is taking steps to rectify the situation. The no jab, no pay policy that this bill seeks to implement will secure the health of our nation's children. The choice made by families not to immunise their children is not supported by public policy or medical research. It is simply fanciful to suggest that vaccination of our youngest Australians harms them in the way that many say it does. Australian children receive some of the best medical care in the world, and this government takes the health of our children as a priority. This is a public health issue. The government has determined that parents still have the right to be vaccine objectors, but their decision will not be endorsed by the provision of taxpayer funds in the form of childcare benefit, childcare rebate or the Family Tax Benefit Part A end-of-year supplement. This government makes no apologies for enacting incentives to immunise our children, and that is what we are doing in this bill. I am proud to be part of a government which has the intestinal fortitude to take a hard stance against vaccine objectors who are risking the health and well-being of not only their own children but of all children. I stand behind the No Jab, No Pay bill, and I urge all members to stand with this bill. I'd just like to reiterate, Mr Deputy Speaker, that 39,000 Australian children are currently at risk of contracting disease due to vaccine objection. I think this is an absolute shame, and I think this is something that this bill is long overdue to address. Under the current system, eligibility for childcare benefits and family tax benefit is linked to immunisation requirements, where children aged under 7 must be fully immunised or have a valid exemption. To oppose the No Jab, No Pay policy, I think, is to endorse the position of the vaccine objectors, and that's something that this government is unwilling to do. This government will maintain exemptions, which I said earlier, including medical and approved religions. The coalition government is, through this bill, delivering better health outcomes for our nation's children. We are taking a hard stance and strongly resisting the baseless proposition that vaccines are causing harm in our society. This government stands with our doctors and our medical professionals. We stand for a better future for all Australians, and that is why we stand for a No Jab, No Pay policy. Mr Deputy Speaker, I think it's appropriate at this time to acknowledge the small number of my constituents that did make representation to my office, obviously in objection to this proposed bill. Can I say to those people that I do respect that they have a different view in relation to this matter, and I do respect that they have an entitlement to not only voice that view, but to actually live it out if that is their choice. But as I have explained to each of them, the government also, on behalf of all Australians, is responsible for good public and good health public policy that in this case means that you can, if you are an objector, maintain your objection, but you will no longer be entitled to taxpayer benefits. I must say at this point, though, that as a part of those discussions, one particular suggestion that came to me by a constituent I think is very worthy of consideration, and that is that it would not be unhelpful for us as a country across all our state jurisdictions to have a national register where children who have a radical reaction to immunisation are registered, and that such GP or specialist paediatrician documentation should be attached to such a register. I don't think that's an unreasonable request for those that still see that this policy is something that they can't support. They have made the case that there are examples, they would suggest many examples, of children negatively reacting to the immunisation programs of this country. I'm not a medical expert and certainly wasn't in a position to argue the toss one way or another with my constituents, but I did feel that that was a reasonable and sensible suggestion that we as a country, through our health professionals, should be able to track such negative reactions to any of the immunisation programs. But once again, I do commend this bill to the House, and I thank those opposite for the support that they are providing also. Thank you.